Salam,
Thank you so much for
everyone.
joining.
Of course, I'm so excited to be talking to the Syrian American Medical Society. SAMS, if people don't know, I'm Syrian, and ever since the Syria crisis started over a decade ago, at the time, I was the biggest fan and supporter of SAMS. So the fact that you're part of the Every Pregnancy Coalition now, and that you're doing such incredible work inside Syria, I'm really, really excited to be here.
Thank you. We're truly honored to be part of this very important and timely challenge. Thank you for
Amazing.
this initiative.
Of course. No, thank you for being part of it. So, how about you tell us a little bit more about the SAMS project and program that you guys are fundraising for this year?
Sure. Yeah. So first, I'll introduce myself. My name is Sawsan Rashdan. I'm actually an oncologist by training, but I'm also a board member of the Syrian American Medical Society. As I said, we're really truly honored to be joining this global movement, which is the For Mama Challenge 2026. This initiative that's really has one powerful mission, which is no mother should die giving life. And around the world, unfortunately, especially in crisis affected areas, we all know what the 14 years of conflict had done to the health system in Syria. Pregnancy is still dangerous.
Mm,
And but the truth of the matter is that most maternal and newborn deaths are preventable,
yeah.
and this is where the importance of this campaign comes in. So, for example, what after the years of conflict and the devastated health system in Syria, unfortunately, pregnant women now have to travel long distances while in labor to give birth. A lot of times they deliver without access to emergency C-section. They face postpartum hemorrhage without blood supply or trained staff. They also, when they have premature babies, there isn't really incubators or respiratory support to save these babies. What SAMS has done is that we do have maternal and child health, multiple maternal and child health programs across many cities in Syria. For example, we have services in Deir Zor, Aleppo, Idlib, Hama, and rural Damascus. And across 9 hospitals around these cities, and also plus primary care centers and mobile clinics, we provide continuous care before birth,
Mhm.
during delivery, and beyond.
Wow.
I'll give you an example what support what everyone's support has done over the last year. For example, in 2025, 22,000 babies were safely delivered
Amazing.
across Sam's facilities, and
Inshallah.
that's amazing. Yes,
Amazing.
um, we have 20 skilled midwives trained to expand life-saving care. We have strengthened our neonatal units. And what this For Mama Challenge can do is that we can continue on providing safe deliveries, prenatal and postnatal care, C-section when needed, which is, we all know how important that is in cases of emergency. But not only that, we also can provide care for the babies after they are born. We can provide incubators, jaundice screening, for example, which very simple tests saves lives of the babies, vision and hearing tests, screening, mental health and psychological support as well. I'm going to give you a little
Wow.
bit more details. So what $100 can do, $100 can provide safe delivery services and newborn care. $200 can support life-saving C-section. $500 can provide neonatal infusion pump.
Wow.
So there is a lot to do. We really truly need the support. We've seen how the support have transformed lives over the past years in SAMS. So this is why we're here.
Absolutely. Wow, what a beautiful overview. I mean, to just think about the impact that you are just doing even in 2025 is absolutely incredible. I think people often forget, right? Because we are so focused on what we see in the media around like the devastation and the primary care services that need support, right? Essential survival, food, water, infrastructure, schooling, education. But then you have SAMS and other partners that are literally tackling maternal newborn health, to make sure that people are having a safe delivery, to make sure that moms and babies are getting the care that they need to just not survive that process, but also thrive. And, we've always said, and I'm sure that you would agree, and I would love to hear more of your thoughts, that when you save a mom's life and you like protect her, you're not just saving the entire family, you're actually setting up the success for the entire society and community. And that you'll always see that investment in a mom multiply, right? Because you can just imagine what she's been able to accomplish and what her family's able to accomplish with her survival and her thriving in that setting. So to have 22,000 like successful births, mashallah, since in 2025 alone is so incredible. Can you tell us a little bit about where you work inside Syria for those who are curious?
Sure. We have different facilities. Thankfully, it was only in Northwest Syria before December of 2024. But now, thankfully, we have many cities that we have maternal services in, and Deir ez-Zor, Aleppo, Idlib. We still have the bulk of our maternity care, Hama, and also rural Damascus. So
Wow.
that's mostly where our services is. We're definitely expanding. In the near future, there's a plan to build a maternity hospital in Idlib that's going to be fully equipped and will service many, many women who are need these services.
Yeah, absolutely. I see now Sam's went ahead and posted the link for donations because people were saying, can you tell us where to donate? Take a look. The link is there, everybody. sams-usa.net/4mama. The 4Mama Challenge, just to tell people a bit more about it. It was a campaign that started 2 years ago. This is the third year we've done it in Ramadan, and it's a campaign that is a coalition effort. So as an entity, Every Pregnancy is not an implementing organization. We are a spine of an incredible network and framework of organizations that are all united on the mission to make every pregnancy safe. We don't believe moms and babies should be dying from preventable complications in pregnancy or in childbirth. No matter where in the world they are, they should have that basic access to life-saving care and dignity and a chance to thrive. And so for the past 2 years, we've raised over $34 million in Ramadan alone as a coalition. And it goes to show you the power of grassroots giving to a mission like this one. And this year we went from 30 plus partners to now we're at over 54 organizations that are part of the campaign this year. And that includes SAMS, which we're really excited about. And so you have over 54 charities that are all frontline implementers on the ground, like SAMS is inside Syria, then around the world in over 20 countries actually, that are all providing this best life-saving care for moms and babies. And so when you're supporting the 4Mama Challenge, you're supporting whether you're doing it to SAMS, or you can continue to amplify what they're doing on your social media. You're supporting this amazing ecosystem and a coalition that's all working towards this. And I love to always say that I feel like for every pregnancy, we don't really see the ego between organizations, that everyone really is focused on the mission here. And we're so collaborative. So I'm just so grateful that SAMS is here. I'm so grateful that Syria is seeing this care and the support from SAMS and other partners that all collaborate amazingly on the ground. Is there anything else you want to share about SAMS in particular, or what to get people to donate to specifically? You said $100 only provides life-saving delivery for a mom and a newborn, right? What does that actually look like on the ground?
It looks like mothers are able to go to their the maternity center that's close to them, get, as you said, get deliver in dignity, and know that that's they're going to have care that's evidence based, that their baby will be cared for after their delivery. This is, even $100 doesn't seem like it's much in our world here, but it's definitely life changing in Syria. It's between life and death for these mothers. And I want to mention here, how resilient these mothers are. We've heard stories from before the liberation, how SAM's facilities were able to help women deliver under bombing. And not only how resilient these mothers are, but how resilient the doctors are. Our SAM's doctors often, left their homes under active bombing to deliver moms. So this is the care that we talk about. This is the dedication and devotion that we talk about, is to do whatever you can, even under dangerous situations, to save the mom and save the baby. Really, really, truly honored to be part of this incredible initiative. And thank you for all this.
Oh no, of course. We have to thank you as our partners. You are the ones on the ground doing this work. And I really love the point you made about resilience and how Syrian mothers, and honestly, no mother is a victim. And that's really the mentality that we have as every pregnancy. We really try to remind people that the women that we're supporting, the moms, the babies that we have the privilege of supporting, are not victims. They're going to survive and they're going to fight for their families no matter what. And so for us, it's about how do we use our privilege and our access and our opportunities to amplify and uplift. And this is one amazing way. So if people are watching, I'm going to make the appeal for SAMS to donate to SAMS, donate to the support that they're doing on the ground inside Syria to help these moms and babies not just survive these experiences that should be preventable, but actually getting the support that they need to really thrive. They're incredible with the work that they're doing, and be part of this. Give your incredible donations for Ramadan. You can give to so many different causes. Just really include maternal newborn health in one of those causes, because it is such an urgent need right now, and it's such a forgotten cause that people don't often think about. So I just want to just give a huge shout out and kudos to SAMS, the work that they're doing on the ground. We're so grateful to having the coalition, and every pregnancy is here to support you all in helping all moms and babies, especially inside Syria.
Thank you so much.
Thank you. Thank you for this awesome live. Thank you, everybody, for tuning in. Take care. Salam, everyone.
Thank you. Salam.